Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, join me and my co-host Alex Ross as we'll discuss the latest in healthcare, health IT, and compliance. In this week's episode, we discuss a proactive health app for teachers, a culinary medicine program, and a breakfast cart in schools, as well as coronavirus. Let's wrap things up. This is episode 24 for the week of March 16th. I'm Matt Moneypenny.
And I'm Alex Ross.
Before we get started, our diagnosis code of the week is W55.21, bitten by a cow.
Oh my good, Matt, I gotta tell you, this has actually happened to me.
Yes?
Because, so I used to live with a cow.
Okay.
I know it sounds strange, but I had a cow in my house. We were actually best friends. His name was Jeffrey.
Yeah, Jeffrey the cow.
Good friend of mine. And, one day I wasn't being so nice. I told him that he looked a little, I told him he looked a little round today, and he got mad and just hauled off and bit me right in the ear.
Wow.
Yeah, it
Sounds
hurt.
pretty dangerous.
Okay, he was my friend, so.
And with that, let's get right into the news. First up, we have educators give a healthy lesson for students. A new wellness initiative at Hollister School District in Missouri is helping teachers stay healthy and stay in the classroom. A new health app was designed specifically for Hollister schools through a partnership with a not-for-profit healthcare system, Cox Health. The app helps teachers be proactive about wellness through movement and diet monitoring, success incentives, and health education. The teachers say that they aren't using the app for themselves, but they're also using it for the students as well. If they take care of themselves, they'll be in the classroom instead of out sick. They also hope to be an example for students to be conscious about their health. I wonder if this is going to help teachers in the future with something like coronavirus when students get back into school.
Are we going to make every story about that this week?
I mean, I feel like it's going to wrap around to that in some capacity,
I
right?
hate to say it, but as we prepare for these podcasts, that's basically all of the news.
Mm-hmm,
It's really difficult to find the other ones. So yeah, I guess everything is at this point coronavirus.
Yeah, it's just an unfortunate time to unveil it at this school because, I mean, I wonder if Missouri's closed schools yet. I don't think they have, but...
Perhaps, but this is an ongoing thing, right?
Yeah.
They're going to continue to use this. It's not necessarily going to make an instant effect with their, different wellness levels, but over time, having a teacher force that is on average more well, I think that'll both save the school some money because obviously they don't have to go and hire a substitute for extra days, but the continuity for the students will increase as well, and I think that'll help them in their learning. I know that we didn't really do anything when a substitute teacher was in.
Right, yeah, no, the substitute teacher comes in and all the kids get rowdy and excited, so.
Right, so I see this as being a win for the students, a win for the school district, and, even a win for the teachers who are the ones getting well.
Right.
Next up, fill your prescription and your stomach with this kind of medicine. Spectrum Health, based in West Michigan, is hosting a series of culinary medicine classes. The Spectrum Health Culinary Medicine program seeks to educate community members on the importance of food as a tool in achieving optimal health. The culinary medicine team is dedicated to improving the current conversation about nutrition, removing the distractions of fad diets, and focusing on the hard science of a well-balanced diet. Seasonal classes focus on heart-healthy foods, plant-based cooking, brain health recipes, and recipes that support healthy joints and strong bones.
So it's an interesting idea by the hospital. It's almost like a how-to video, but it's a class for,
Well, to circle back around, it probably will be an online video now.
Yeah, because of the coronavirus. So everything comes back to that. I think this is a good option for people to just, either get out of the house and do something productive or just, learn a little bit more about eating healthy.
Right. People take cooking classes for fun and to help learn new foods, things that they can eat. So I see this as being a pretty reasonable alternative to your standard just cooking class, where there's a goal with this cooking. Rather than let's make delicious food, it's let's make delicious food that is healthy for you, that targets certain, aspects of your health, like joint health, and can therefore cater to specific groups of people who are most interested in taking care of those aspects of their health. So I like this idea. I would attend one of these classes, especially if they had something that was, specific to my personal medical situations in some way.
Yep. Next up, we have breakfast after the bell. Martin Luther King Jr. School in New Jersey offers a new in-school breakfast cart provided by Gen Youth and partners of the PepsiCo Foundation and American Dairy Association Northeast. The cart will help the school expand its breakfast after the bell program, allowing students to pick up healthy items on the go. 1 in 6 children nationally is food insecure, but this is part of the effort to deliver 370 breakfast carts to schools around the U.S. this year to give all students access to nutritious meal. Wrapping it back around, not right now, they're not.
Well, at least not in Ohio, they're not.
Yeah.
I like the idea, though. Do you think this is... See, when I imagine a cart, I'm imagining like a basket of apples.
Continental breakfast at a school. Let's go.
Like a cereal bar.
Yeah.
Not like full breakfast meal.
A
Do you
waffle
think that's
maker.
what they're going for? Like just a snack, if you will, that kids can grab as they're walking down the hallway.
Yeah, probably like
eat
those little
quick.
mini cereal bowls with like one of those tiny little cartons of milk and like some
Absolutely.
breakfast bars and stuff like that. Apples and bananas and all the healthy options for the
I
kids.
like to eat apples and bananas.
Me too.
I also like to eat ooples and bananas.
You do.
Less opportunities for drinking a Corona at your local sporting event, as they're all canceled. COVID-19, also known as coronavirus, is officially a pandemic. At the time of this recording, only 5 people in Ohio have been tested positive, but Governor Mike DeWine is taking precautionary measures. The office of the governor is currently estimating about 100,000 people currently infected, but not known. College campuses suspended all in-person classes from anywhere from 2 weeks to a month. K-12 schools are closed for 3 weeks. All public gatherings over 100 people have been canceled. Nationally, the NBA suspended their season after a player tested positive for the virus. MLB delayed the start of their spring training. The National Hockey League suspended their season. The NCAA canceled their sports tournaments and all spring sports. And on an international level, travel from the U.S. to 26 European countries is banned, and Italy is on lockdown. New cases in China, though, have seemed to have slowed.
Yeah, everything's being canceled right now. They canceled F1.
We're canceling toilet paper for the rest of the year, apparently.
Yeah, apparently toilet paper is the new post-apocalyptic currency, so make sure you stock up.
Yeah, I'm really disappointed that I had all of my bottle caps
thought
ready
for
to
sure
go.
it was going to be bottle caps, but apparently not. Apparently
Should have been
it's
stocking toilet. I saw someone the
just
other
three-ply
day.
toilet paper.
It was obviously a joke, but they were suggesting that they were selling toilet paper for $10 a sheet.
There you go.
And I thought to myself, no. The maximum price for a sheet of toilet paper is $1, because after that, I'll just use the dollar bill.
Yeah, true. Right? Or just, a stream if you have to. You got to do what you got to do, I guess.
Absolutely. Though, so, it's looking very contagious. It's looking like we're going to have to deal with this. But do you see this being the kind of thing we're fighting for a long time? Do you see this being something that, for example, comes back again next year, much like our seasonal flu?
Well, they are saying that they're saying that cases in Ohio are expected to peak around April to May.
Okay.
So right now we're in mid-March and we've got a long way to go from that. So if that's the case, then we're going to be in lockdown for quite some time.
This is going to be the worst summer.
Yeah, or potentially the best summer, because once it's over, everyone's going to be wanting to do stuff all the time and just get out of their own head.
Well, okay, so for me this summer, I have a lot of outdoor stuff planned, and that obviously is not going to get canceled. Going camping or going hiking or things like that.
They did cancel they actually closed down the Cleveland Metro Parks.
Did they really?
They're starting to close down parks as well.
Okay, well, they'll have to catch me sneaking in at night, because there's no way I'm not going hiking this summer.
Yeah. And this is a big deal for us because we actually are all from Ohio and living in Ohio currently. I mean, we might not all be from Ohio, but we are currently living in Ohio because this is where we're working. So that's kind of why we're breaking it down from the Ohioans' perspective. But it'll be interesting to see what other states do as well.
I think other states are taking similar measures, especially, I know for sure that Washington has closed down a lot of their public schools. So other states are following suit, just trying to slow down the peak so we don't overwhelm our friends in the healthcare space. And a lot of companies even are starting to implement like telehealth policies, or a lot of healthcare providers are starting to implement telehealth options, especially behavioral health groups. They've started implementing telehealth appointments that they wouldn't have had otherwise. And then other companies in the commercial world are also following suit by allowing their employees to work remotely. And I think this is overall great. We're developing some awesome systems that in the future are going to provide great benefits for us.
It's a big test for the current society, for sure.
It is.
And with that, let's go on to our next segment.
BREACH, Breach Patrol. It's a breach!
All of the latest cybersecurity breaches. Welcome to Breach Patrol, where we talk about the latest breaches all across the world. First up, we have I wanted unlimited data, not a data breach. T-Mobile revealed that it experienced a security breach that has potentially impacted account information of employees and customers. The company's cybersecurity team recently identified and stopped a cyber attack against its email vendor. The attack gave unauthorized access to certain employee email accounts, some of which had information for customers and other employees. T-Mobile didn't reveal how much data was exposed, but both current and previous customers are affected. The company is in the process of sending out SMS messages to all affected customers.
It's interesting that T-Mobile's the one who caught the attack against its email vendor.
Yeah, right.
Good on them for sort of staying on top of it.
Vendor evaluation.
Yeah, I'm guessing a new vendor is coming here pretty soon for them.
Nah.
I'm really, I'm kind of curious with the idea of sending out notifications via SMS. It's like, oh, I got a text message about a data breach. I feel like that's,
is this sketchy?
That's kind of short form, right? It's not designed for you to make a statement and, provide the necessary information to your clients, your customers, and your former customers. How are they going to find them?
Yeah. No one, I feel like this is the best option for them because they are a phone company and sending an email rather than just using all the phone data that they have makes sense.
Right.
Other than the fact that people could be like, this is kind of weird that I'm getting a text message from my phone provider, right? I mean, I guess that could be kind of strange, right?
Yeah. Saying, click on this link to
because
learn more.
People do get text messages that are like attempted phishing attempts. So Who knows? But I mean, good luck to all the people out there that are feeling the waves of this breach, if you will.
All right. Next up, taking a cruise to the beach. The cruise operator Carnival Corporation recently stated that it suffered a data breach last year. The company had noticed unauthorized activity on its network in May 2019. Attackers gained access to employee email accounts, which lasted for over 3 months. Carnival hasn't mentioned the exact number of affected customers, but they continue to investigate the matter with cybersecurity forensic experts. They're reviewing their security procedures to prevent further issues, and they're offering free credit monitoring and identity theft services to those affected. They assure no data abuse, but they still advise customers to remain vigilant against any fraudulent activities. At this point, with literally every company from Carnival to, your local healthcare group getting breached, everyone should remain vigilant against fraudulent activities. Always. Just don't stop. Ever.
Yes. Definitely a bad time for the cruise ship industry.
Oh, yeah. Well, the good news is, other than us, I'm guessing that not a lot of people are talking about this right now. Because they're too busy talking about how nobody's taking a cruise. All these cruise ships.
Yeah, and all these cruise ships had people with coronavirus on it.
It is just a bad time.
Definitely.
Be the cruise line industry.
If you shorted the cruise line industry on the market, you're doing pretty good right now.
Well, I'm expecting that we're going to see with our cruise companies something similar to, the unfortunate downfall of Boeing, right? Other companies are going to start taking the major share after some of the mishaps and accidents that have happened. And then at the end of this, we're not going to have as many companies still standing.
Yeah.
Because right now is kind of like the acid test for all of the companies, and it's really only the strongest ones that are going to be able to survive this and continue to serve people.
It also
afterwards.
goes to show you that with all this stuff going on in coronavirus, it definitely opens up the door to attackers being like, okay, this company's dealing with this one big deal. I'm going to try to see if I can get in and find some vulnerabilities because no one's paying attention to their cybersecurity. So with that in mind, of course, if you're a healthcare company, your number one goal is to take care of your patients, especially if they have this virus. But also keep in mind your cybersecurity, because the last thing you want to do is try to take care of these people with this virus, and then you get hit with a ransomware attack and can't, because that would be completely. I mean, that would be
absolutely
terrible.
devastating. Yeah. So if you don't have a good cybersecurity plan in place today, you should probably start working on those, and certainly keep it, up there in your
top of mind.
Yeah, top goals of what you got to accomplish right after helping people. And that's it for this week's wrap-up of your weekly healthcare news. I'm Alex Ross.
And I'm at Moneypenny.
And we'll see you next week. Thank you for joining us for this week's episode of The Bandage. This week's episode was written and produced by eTactics. eTactics is a leading revenue cycle solutions organization committed to providing innovative, web-based solutions that improve our clients' cash management and customer relationships. Thanks, and we'll see you next week.